Hisar Foundation, and Engro Foundation, in association with TV1, News 1, Wasaib, and FM 91, presents the 5th Karachi International Water Conference webinar series on climate change and pandemic impact on water.
I welcome you to the 5th Karachi International Water Conference, which is being held this year as a webinar series on climate change and pandemic impact on water.
There were serious issues with respect to availability of safely managed water. Water, if you drink, you will be sure you will live, but there are many places where we drink water and at your own risk. So there are serious challenges which were there.
26% of the global population doesn't have access to safely managed drinking water. We need to move forward. We need to find a way to integrate all these issues.
We need to learn from our COVID experience and come together as one. And the whole world needs to be on the same page like it was for COVID.
I would like to invite Dr. Sheikh Tanveer Ahmed.
Thank you, Dr. Shahzad, and thank you, Hisar Foundation, especially CV Kamal, for providing me this opportunity. Let me share my presentation and then I can go ahead. I'm going to give you a case study of hands with respect to the COVID-19 and water. Hands vision, as you know, is quality of life for all in an equitable, human, peaceful, and sustainable world. One can imagine the scale of the organization. If I briefly describe you the highlights of 2021 only, we have done. We have received a grant of nearly 2.5 billion rupees as per our average annual grant, which we have expanded out in nearly through the 33 branches, which is our district offices, and 10,505 workforce. We did it with 92 projects, and we have reached to nearly 31 million population of 25,000 villages or urban settlement. We have done this intervention in nearly 56 districts of the country, and our direct beneficiary was of nearly 6 million. So if we talk about the pandemic challenges, so I can compare the challenges into two areas. One is when in March 2020, the pandemic started, there were two kind of the challenges we face. One was at the community level, the community-based challenges, and the other was with the organization or services-based challenges. So let me start with the community-based challenges. One, as you all know, that the hand washing was the prior requirement as far as the prevention is concerned. So we have seen a lot of challenges as far as the not only of the knowledge but also the accessibility and availability of water for the hand washing in different places. The affordability and accessibility of soap in the rural and remote communities. Then accessibility of safe sanitation was a challenge. As you know, rural areas of the country don't have a very good sanitary systems, although we are working on it. And then awareness of health and hygiene was again a challenge. As soon as the lockdown and the incidence rate increases, the transportation becomes one of the challenge for the community, not only for going to for the livelihood, but also to the health facilities. Increased domestic violence is again comes as a challenge in the community when people were stopped to were locked down, asked them to stay at home, so the domestic violence increases. Similarly, livelihood issues, as we all know, increases with the rate of the incidence rate of the COVID. In our services base, and when I say services base, since we as an organization working as an organization, as offices, and then we work through the health and education and the other services through some facilities, hospitals, dispensaries, clinics, or schools. So availability of the protective environment, protect not only in terms of the tools, PPEs, like mask, gloves, sanitizer, for example, was also a great challenge. And then the accessibility of water and washing station within the hospital. And since we work more in most of the public sector hospitals, the public sector hospital was not really ready and prepared and equipped with the hand washing facilities for the providers, and the client was also the question. What a great question. The accessibility of hand washing station, as I said, was a great challenge. Then the toilets availability, sanitary facility, for example, in the hospitals, in the schools, and the other facilities was also a challenge. Knowledge of sterilized techniques, not only the medics were not very used to of this kind of the sterilization, which we are asking in the COVID situation, but also the paramedics in the hospitals, teachers in the school, and the students were also went through this challenge. Again, transportation at the hospital level, transportation not only for transporting the staff to the organization, but also transportation to the health provider, to the hospitals, and was a great challenge, which is reduced as far as the incidence days increases and the lockdown period is. Considering the organization working in emergency area, we have got the special permission from the Home Department and the Health Department to work in the lockdown timing as well. And so we use our transportation with the special mark on the special and emergency services, and we were allowed to do it. But even then, transportation was a challenge for many of the, most of the staff members. Same reflected in the low staff attendance, high COVID positivity in the staff, especially the healthcare provider, who was really on the forefront of the water sanitation issue. We also work on strengthening health facilities. We were taking care of the hundreds of the health facilities, especially the isolation and quarantine centers of those health facilities, in terms of not only of training of the medics and paramedics, but also providing them the PPEs, the other sanitizers and other facilities. And then also provide them provision of the washing units for them, for not only for providers, but also for the patients and clients. We have done intervention in the school projects, school area as well. Hundreds of the schools were given with the soaps and to maintain the hands and hygiene, and not only so, but also the mask and the sanitizer as well. Similarly, these very innovative kind of the work was done by hands, the staff of our water department, that the paddle hand washing station installed at the public places and healthcare facilities. These are the untouched paddle stations, which is installed in many places across Sindh, and then in southern part of the Punjab also. In few facilities we have provided to address the scarcity of water out of plants in health center, and then the wash facilities also provided to many of the schools and the hospitals. Provision of water and water tanker was one of the facility which we have provided to nearly hundreds of places, just to address the hand washing issue and sanitation issue.
Sir,
yeah.
I think you have 2 minutes, kindly.
Okay.
If you could
wrap. Capacity building is done through psychological counseling services, We have thousands of workers, community-based worker. We call it Mavi worker and community resource person. Through them, we did the counseling session. We have done a study which tells us that 50% of the population was under depression at that time. So counseling proves a very important area. Teacher were trained, sanitary worker were trained, and then the healthcare provider was trained. So provision of material, as I already said, a lot of material on sanitation and hygiene was made. The community outreach, mass communication took place. A lot of intervention through radio, talk shows, through SMS messaging, through LED plays in public spaces, Android phone provided to the Mavi workers. Through with the awareness raising, and we have reached thousands of students and religious leaders to raise the awareness raising. So this is a material which we have developed. So many material during this period COVID. Then we went into the COVID vaccination. Once the vaccination started, nearly more than 300,000 shots was given in terms of with the partnership of many of our corporate partners. The recommendation which I want to make as a last slide of my presentation, that highest permanent forum in Pakistan to establish both at the provincial and the federal level with multi-sectoral stakeholder to deal with any pandemic in future. An endowment fund needed to be allocated with every year incremental on the incremental basis, so that any pandemic can be addressed as an emergency. The strengthening of integrated public and private health system required, which is very we have realized that there is no integration of health and public and private health system in the country, both at the primary level, secondary and tertiary level, and with optimal watch facility. This should include the health management information system to effectively deal with the pandemic in the future. Accelerated digitalization. Digitalization provide opportunity for us, as we have done in the organization, then it should be done in the health system as well. So proactively involve the mass media communication, which we have learned that very well done by the NCOC in the country, and this mass media model remain should be engaged with the other diseases and pandemics of the strengthening of research and development in the university to provide backup support is again an important area. Vaccine manufacturing is required locally to and to that need support to the private sector, and strengthening of emergency and transport system, both for providers and clients, is required when there is a pandemic. So this is all from my side. Thank you very much.
So kind of you, sir.
मैं आप सबका ममनून और मशकूर हूं। आगे बढ़ने से पहले मैं आपको अपनी प्रेजेंटेशन दिखाना चाहूँगा, जिसका मौजू केस स्टडी हैंड्स है। पानी और कोविड-19 के हवाले से हैंड्स का विजन है एक पुरअमन, मुनसिफाना और पायदार दुनिया। मैं यहाँ आपको 2020 और 21 के नुमाया कारकर्दगी के हवाले से बताना चाहूँगा। सालाना ग्रांट हमें 2.511 मिलियन रुपए की मिली, जिन्हें हमने 33 डिस्ट्रिक्ट ऑफिस में दिया, जहां मेहनत कशों की तादाद 10,505 है। यहाँ हमने 92 प्रोजेक्ट्स पे काम किया और 31 मिलियन आबादी तक रसाई हासिल की। तकरीबन 2,500 से ज़ायद देहात, 56 अजला में काम हुआ और 6 मिलियन लोग इससे मुस्तफ़ीद हुए। यहाँ अगर मैं आलमी वबा में दरपेश मुश्किलात का जिक्र करूँ तो 2 तरह की मुश्किलात आईं, एक कम्युनिटी की सतह पर, दूसरी खिदमत की सतह पर। पहली बात करते हैं कम्युनिटी की। लोगों को हाथ धोने की तरगीब देना, फिर पानी की तक रसाई होना, साबुन तक रसाई और क़ुव्वत ख़रीद होना, सफाई सुथराई के अमल तक रसाई हासिल होना, सब एक चैलेंज की सूरत में सामने आए। वबा में नक्ल हमल के हवाले से भी लोगों को काफ़ी मुश्किलात का सामना करना पड़ा और घरेलू तशद्दुद के भी वाक़यात में इजाफा सामने आया। इस तरह रोज़मर्रा ज़िंदगी में बहुत से मसाइल सामने आए। बहैसियत ऑर्गेनाइजेशन हमने जिन चीज़ों में मसाइल का सामना किया, इनमें से मास्क, सैनिटाइज़र, दस्तानों वगैरह की फरहामी, पानी और साबुन की फरहामी और हाथ धोने की सहूलत को सबके लिए यकीनी बनाना, बैतुल खला तक रसाई, जरासीम कशी के हवाले से आगाही, नक्ल हमल वगैरह शामिल हैं। कोविड-19 की वजह से स्टाफ की हाजिरी में कमी रही, जिससे काम में खलल वाक़ हुआ। اور کووڈ-19 میں خاصا اضافہ ہوا، خاص کر ڈیلٹا میں۔ پانی کی صفائی اور حفظان صحت کے اصولوں پر ہم نے خدمات پیش کی۔ ان میں اسپتالوں میں حفظان صحت کے اصولوں پر عمل درآمد کو یقینی بنانا، قرنطینہ سینٹر کا قیام اور ان میں حفظان صحت کا خیال رکھنا، اسکولوں میں ہاتھوں کی صفائی کے حوالے سے نہ صرف آگاہی فراہم کی گئی بلکہ ماسک، صابن، سینیٹائزر کی سہولت کو بھی یقینی بنایا گیا۔ ہینڈز کی طرف سے پیڈل ہینڈ واشنگ سولر قائم کیا گیا۔ ہیلتھ سینٹر میں RD گلینڈز لگائے گئے اور بہت سے اسکولوں اور ہسپتالوں میں ہاتھ دھونے کی سہولت متعارف کرائی گئی۔ اس کے علاوہ کمیونٹی میں سینکڑوں کی تعداد میں پانی کی ٹینکرز پہنچائے گئے تاکہ پانی کی فراہمی اور صفائی کو یقینی بنایا جا سکے۔ اس کے علاوہ صفائی کی صلاحیت کی تعمیر کے لیے جو اقدامات ہم نے اٹھائے، ان میں نفسیاتی مسائل کے حوالے سے مشاورت کی خدمات نمایاں ہیں۔ ماروی کے لوگوں اور CRPS کے لیے ذہنی تناؤ ختم کرنے اور ان پر قابو پانے کے لیے سیشن کا انعقاد کروایا گیا، کیونکہ وبا نے تمام لوگوں کو ایک قسم کی ذہنی دباؤ میں مبتلا کر دیا تھا، جس کے لیے ایسے سیشن کروانا بہت ضروری تھا۔ اس کے علاوہ صفائی کے حوالے سے جتنی بھی ضروری اشیاء تھیں، ان کی فراہمی کو یقینی بنایا گیا۔ اس کے علاوہ ابلاغ عامہ کے تحت لوگوں کی آگاہی دی گئی، جیسے کہ طلبہ کو آگاہی مہم کے ذریعے کووڈ-19 اور صفائی کے حوالے سے آگاہی فراہم کی گئی۔ ریڈیو ٹاک شوز منعقد کروائے گئے۔ ماروی رضاکاروں کے لیے اینڈرائڈ فونز فراہم کیے گئے تاکہ وہ لوگوں کو آگاہی دے سکیں۔ سوشل میڈیا کے ذریعے لوگوں کو آگاہی دی گئی۔ عوامی مقامات پر LEDs نصب کر کے آگاہی مہم چلائی گئی۔ مذہبی رہنماؤں کی مدد سے عبادت گاہوں میں آگاہی پہنچائی گئی۔ اس کے علاوہ وبا کے حوالے سے آگاہی کے لیے IEC مٹیریل بھی لگوایا گیا۔ پھر جب حفاظتی ٹیکوں کی مہم شروع ہوئی تب ہم نے اپنے شراکت داروں کے ساتھ مل کر آگاہی مہم چلائی اور 300,000 لوگوں تک رسائی حاصل کی۔ سفارشات کے حوالے سے میں چاہوں گا کہ مستقبل میں ایسی وبا اور اس سے ہونے والے نقصانات سے بچنے کے لیے ہمیں مختلف اداروں کی مشترکہ خدمات حاصل کرنی چاہیے۔ سالانہ فنڈز اس مد میں ہونا چاہیے۔ صحت اور صفائی کی آگاہی اور اس کے انتظام کے سلسلے میں کام کرنے کی ضرورت ہے۔ مستقبل میں وبا کے اثرات سے بچنے کے لیے صفائی کے بہتر انتظام کی ضرورت ہے۔ ابلاغ عامہ کے ذرائع کو ڈیجیٹل سطح پر تیز کرنے کی ضرورت ہے تاکہ صحیح خبر عوام کو پہنچائی جا سکے۔ یونیورسٹی سطح پر ڈیولپمنٹ ریسرچ کو مضبوط بنانے کی ضرورت ہے۔ ویکسین بنانے میں پرائیویٹ سیکٹر کی مدد درکار ہے۔ نقل و حمل کو فوری بنانے کے لیے اس نظام کو تیز اور مضبوط کرنے کی سخت ضرورت ہے۔ بہت بہت شکریہ۔